To House Republican Conference Vice Chair Congressman Collins on the GOP, not looking like it's on the same page yet. Thanks for joining us. I think we heard comments from President Trump that signals that he believes that perhaps you guys are going to start moving closer. When I say you guys, the House and Senate Republicans. And some of the things I'm hearing now as potential compromises would be a freeze on Medicaid expansion, and also a work penalty, if you will, some sort of, hey, if you're on Medicaid, you got to get out there and you got to hit the bricks, and a 30% penalty, that somehow getting rid of that 30% penalty. So it feels like there are constructive ideas out there to bridge this gap.
Well, I think so. I mean, I think what we're seeing here is a Republican Party that doesn't act like the Democratic Party and simply falls in line and does whatever leadership tells them to do. We're Republicans. We've been listening to the American people. We've been working with the American people. This is a process that is messy at times. Legislative process, going back to the founders, was never meant to be easy, but it was also meant to take into account the views of the American people and also their concerns. So I think the words that you're hearing, things that could be changed, possibly added and made at this point, are something that's valid. But it's been talked about, just previous on your show. I think we're moving forward. We've moved through two committees. We moved through the Budget Committee this morning, and it'll be come through rules and hopefully to the floor next week. So we're doing what we're supposed to be doing. And the Senate, who has a lot of ideas, it seems like right now, well, they'll get the bill pretty soon, and then let's let them go to work on it as well. Yeah,
you moved through the Budget Committee, but you had three House Freedom Caucus members who did not participate in that. And that's something of a red flag of things to come. Certainly, their conservative brethren on the Senate side probably won't be swayed, at least in the current configuration of this bill.
Well, I think they needed to vote the way they needed to vote, and I think that's what we're looking forward to, and they're bringing their concerns, but the bill got out. The bill is moving forward. I think that's what's missed a lot of times, and I think the President and Vice President, especially yesterday while he was on the Hill, said that, confirmed that the President, Vice President, the administration, has our back up here. They're working to make this the best bill possibly can and move it through the process. Are we all going to agree on this? No. But I think, just like it's been said in many outlets, including Wall Street Journal and many others, this is our biggest chance to make some changes to our healthcare system and the federal bureaucracy from Medicaid on down that we've had. And this is our best opportunity to do it, and we're looking forward to continuing that process.
The CBO scores the bill as it is right now, showing an increase in premiums until 2020, when you have an inflection point and they start to come down. A lot of elections between now and then. Can you go back to your constituents and say, hey, we put through what some people are calling Obamacare 2.0, and your premiums are still going to go up near term?
Well, I think what you've got to understand is this has been a process, and for those who are saying that kind of, using that kind of language, explain how they're going to go home and vote against it, how they're going to go home and say we did nothing, or how we wanted something, but yet we chose not to get everything that we have. I think we got to continue to work. There are valid concerns here as we look forward to it, but when you take the CBO score into account, when you look at the other aspects of the Tom Price working at HHS, and then other bills that we're going to pass, that is part of a whole market solution. So we're looking to make sure that that works, and in the next week or so here in the House, we're going to have those conditions, and we're going to look at adding things that maybe need to be it or take it away, put it to the floor, let's let a vote on it, and then get it to the Senate. And for those who've had a lot of questions over there, I look forward to their discussion. It'll be part of the legislative process.
All right, Congressman Collins, thank you very much for taking the time for us.
Charles, always good to see you. Take care.
Same here. Meanwhile, President Trump's revised travel order